Dr. Gupta is back. He's from the ANP Foot and Ankle Clinic right here in Des Moines. It's great to see you.
Same here.
I understand that you work with a lot of patients with diabetes, and it's always intrigued me. What is it about diabetes that affects the extremities so much?
Well, diabetes, when diabetes is not properly controlled, it's going to cause effects on many different systems. You can start with your eyes, your kidneys, your circulation, your immune system, to the ability to fight infections. All of those are affected by diabetes, and as the circulation is compromised, as the immune system is compromised, feet take a lot of pressure. Feet take a lot of pounding. So you're going to get a little cut or a little bruise or an ingrown toenail, or you're going to develop a callus or a corn. And when that is unattended or not taken care of properly, there are chances of developing infections. Once you develop an infection, because of poor circulation, even the antibiotics are not going to get there to treat that infection. Person already has a compromised immune system that's not allowing that infection to heal. And, that just kind of propagates into a problem where you have a wound on your toe or your foot and you can't heal it. Ultimate answer becomes as an amputation. And, and one of the things that I, stress with people is, if just because you have an ingrown toenail and it goes bad, doesn't mean you're only going to lose the toe. Because the doctor who's going to do your amputation has to do the amputation at a level where you have good circulation.
Well, and who would think that a little thing like an ingrown toe or a toenail would have that effect? But what you're saying is that you're not just going to have to remove the toe, that the circulation, say that again?
The circulation, a lot of times, a lot of people have below the knee amputations because their circulation is best where the major arteries are, and below that, as the arteries become smaller, the blood vessels become smaller, the circulation isn't quite as good. And so the doctor who's going to do the amputation, he's going to have to do it where you have circulation. Otherwise, you remove a toe, and the wound from that removing of the toe won't heal.
Now, how do you help?
What we do is, first of all, evaluate the feet and see if a person has some type of imbalance or if they have some type of deformities that are going to cause some calluses or corns or friction on the skin and cause wounds. You have to see if they're wearing proper size shoes. In so many years of practice, 21 years, I've rarely seen people wearing proper size shoes.
And then you also have too the what are these called? The inserts.
Right. And this is kind of what I do is, we take a mold of a person's foot, and this mold is taken in a non-weight bearing position where I hold the person's foot in a neutral position where most of the joints are lined up as best as they can be lined up. And so once we've made this, we will make a positive cast of that, and then we take the insert materials and mold them.
And these are custom to their feet. They're not like something you'd buy over the counter or over the shelf.
No, these are custom made, and the pressure points are accommodated. And basically what this will do then is even out the pressure on the sole of the foot. So you don't have focal pressures in one point or another.
And where can they find you if they want more information, if they want to visit you?
Well, we have two clinics. We have one in Des Moines here on Southeast 14th Street and one in Indianola.
Great.